Okay, guys, so we're going to talk tonight about group counseling. You are muted, but you are more than welcome to join in. I'm going to go over the lesson for a little bit, and then I'm going to ask for questions. But if you have a question while I'm doing this, it doesn't matter at all. Just let me know. I'll let you know I'm looking forward, and you're to the side of me. So if I haven't answered you in your question in the chat box, just say something, okay? Okay, so in general, I am a huge fan of groups. I love group therapy. I just do, because I think the therapist doesn't have to work so hard. I think what happens now in the beginning stages of group, of course, it's a pain in the butt, right? You got to do that whole getting everybody together, make sure they show up. But the whole group, the process of group is that the group dynamics, well, that's where the healing will happen. Okay, so that we come in, we're very quiet, we're very shy, and all those good things, but eventually we'll get cohesive, we'll trust each other, and the therapist doesn't have to work so hard. So that's what the process of group looks like. In the beginning, if you see a question that, oh my gosh, the clients, they come in and they keep fighting, it just know what to do, you write it out. Okay, unless they're physically fighting, you just write it out. Okay. Some of the goals of group, of course, you learn to trust yourself and others, some self-knowledge about yourself, increased direction, um, tons of types of groups. So for the test, there's definitely a difference between a counseling group and a therapeutic group. So just know that. So a therapeutic group, the assumption is that there's some kind of mental health issue. A counseling group could just be some growth, some understanding. Guidance, most often are what you're going to find in groups. A guidance counselor does a group, a career group on how to guide you to that. Okay, and again, my counseling groups are not the same as the psychotherapy. So just remember, the counseling groups are just kind of, again, the school guidance counselor, maybe some prevention, maybe some education, but it's not the same for the test as a psychotherapy group. A psychotherapy group is one that's most often going to be inpatient or people who've just recently left. So it's really about working on their mental health issues. There's always questions about who's not appropriate for a group. When you're looking at doing the group, what I'm looking for is how well do you function? Okay, you can have a diagnosis of schizophrenic, but if schizophrenia, but if you are well functioning and you can have a conversation with me and not the 6 voices in your head, we're good, right? So it's always your level of functioning, not your level IQ, not your diagnosis. It is how well do you function? Okay, so that's what we're looking for. Okay, so then my psychoeducational groups are the learning groups. Okay, they learn, I'm teaching. You'll see in the question that they are teaching you something. So the counselor is teaching parenting classes. The counselor is teaching. Go back to the question, prove it in the question. That's how you will know. Okay, structured groups most often have a plan. Structured groups are most often my closed groups. Not always, but they're most often closed. You've got 12 weeks of anger management. You've got this and this and this to feel. It is very structured. It is, we've got to get this done and get you out. Okay. My self-help groups, of course, we talk about those are NA and the AA kind of groups. Also some other self-help groups. My T groups, those were really popular back in like the 70s before most of you were born, I know. But when groups came out, it was a really cool thing. And like we'd go with all of these people together and have a training group. You probably still do it now, pre-COVID. It's just not called a training group. It's called a workshop or a meet or something. But those have been there for a while. My task groups, of course, if you've ever been a parent on a school or in your office and the boss says, you say you have a good idea, I think we should do this, and they appoint you as the committee head. That's a task group. I need you to figure out how we're going to plan the Christmas party. I need you to figure out how we're going to get these parents more involved. So there's a specific task, and we're going to make sure we get it done. Okay. So then my group dynamics, that's where the healing happens. There's two things. There's content. Content is what we talk about in group, but the dynamics are when we let our guard down and the cohesiveness builds. That's where the process happens. And I love group. Like I said, I've done several hundred groups. Okay. So sometimes that group cohesion begins very early and people are so tight. You know, you're on like week 3 and they're ready to like spill their guts to each other. Sometimes you have groups that people are very reserved, and it takes a long time for those dynamics, the cohesion to begin. All groups would go through the stages according to most of the theorists. But each group is different. Each group is different. Okay, again, group cohesion. That's what it means. That's what we want. Okay, we show up every week. We go to AA every week. Is it because I'm dying to get clean? Most often not. It really is just because those group of people over there, we're tight. We're tight. I've got support. When we talk about Yalom, we'll talk about his curative factors. He said it happened in group. So group members are likely to identify with members who are perceived to be attracted or have power. So if you're attractive and hot, you got lots of people sitting around you, right? So I don't know how accurate that is or how that came up with, but that might be a test question. Okay, people who are perceived as attractive or who have power. Okay, lots of group roles. You'll see all of those on there. The facilitative building role, again, you're not assigned these roles in group. Those are roles that you pick up. Okay, and also those rules can change all the time. Like this week I was a maintenance person, and next week I was this. So those rules are group members assign them themselves, most often during that norming stage. Okay, so facilitative or role building, and group members feel a part of the group and they contribute to it positively. The maintenance role, okay, the bonding of the group. The blocker, you'll see that all the time. The blocker is going to stop anyone who's got a new or different behavior. So many times a blocker will be someone who's, they've gone through their crisis and everybody else has shared and it's his turn to share emotionally and he doesn't because he's not ready to go there yet. And many times he's going to block the entire group from going there as well because he's just not ready. Okay. Styles of leadership, you know those. My authoritarian, that's the boss. I'm going to tell you exactly what to do in group. Those work fine in groups, and especially many times we are very short or task-centered. We got to get on and get this done and get out of here. Well, I need an authoritarian group. I can't have people like old laissez-faire taking their time. So it has its role in places. Okay, so that's my autocratic group. Quick decisions. Democratic group, of course, everybody has say-so input. And laissez-faire, it's my best, New Orleans accent, but laissez-faire means fairly lazy. They're the kind of people that kind of sit back and let the process happen. And that's really okay. There are some groups that you can do that. But the style of leadership really depends on what that group needs. It's not about the therapist or the client. Remember, it's never about the counselor. It's never about me. It's about what does that group need. Okay. Oh, my lovely active listening skills, right? Now, those happen in group as well as all of the other times we have interactions with other people, right? So active listening, of course, is making eye contact, having a conversation with them. Reflecting, remember when you reflect, you're always going to reflect back with feelings. Okay, a client tells you something and maybe they didn't say the feeling. So when I reflect back, I'm going to say, well, it sounds like to me that was painful. Maybe that I'm going to give it back with feelings. The goal is they don't have the feelings that they don't have the words for the feelings. If I'm wrong, they will correct me in a heartbeat, and that's an okay thing. No, Dr. Pam, I'm not mad. I'm sad. That's okay. That's okay. Okay. Clarifying, girl, gentlemen, I am sorry. I have. This is my third 16-year-old I have, and she uses words that I have no idea what they mean. And I'm like, excuse me, what's that? Wait, back up. What did you say? It's okay to stop in the middle of the conversation to clarify because we can't have this whole hour therapy session and I have no idea what you're talking about. Okay? So she'll say something, whatever today's slang is, like, what? So, because usually what I think it means is a lot worse than what she's actually telling me it means. So I'm like, oh, wait a minute, okay? So be sure you clarify. It's okay. It's okay to stop the conversation and say, okay, can you explain that to me? Summarizing, of course, is at the end. So you summarize with all of your individual or groups, right? At the end, this is what we worked on today. This is what we're going to do next week. How do you feel? All of those things, again, core listening skills. And these are not just for group. You'll see these questions, these terms most often. Now, facilitating is a group concept, of course, because that's what my goal is to facilitate the process. Okay? Empathizing, we do not feel sympathy. I'm sorry, we're not capable of that. Everybody shows your client sympathy. Something bad happens. I am so sorry. Oh my gosh, That's not our role. Why would it come as a professional person to feel sorry for them? No, we can empathize. I can understand when you made that decision, how that made sense to you. That's empathizing. Okay. Interpreting, again, that's helping me clearly understand. Okay. And then questioning, of course, we get paid to be nosy, right? Paid to be nosy. That is our job. Okay. Questioning, of course. Linking. Linking is what happens in group. So then, last week, Bobby over here told me that, he was upset because his wife had left him, 3 years ago. And then all of a sudden, Mary says, "Oh, my husband left me." I'm saying, "Bobby, can you share with Mary what that was like?" Or, "Bobby, didn't that happen to you?" So I'm linking my two group members together so they can have that support for each other. Confronting. Most often we're going to confront in my drug groups. You'll see confronting be okay, the right answer for other sometimes questions, but as a rule, I'm confronting for my drug groups. Okay. So then my, let's see, supporting, that's what we do. Blocking is again, there are people who are blocking. And sometimes the counselor, I have to block, especially in the beginning sessions. I'm hoping that after a while, the group will take care of itself. But if I've got little Jim Bobby Joe over there who won't stop talking, in the beginning, I'm going to have to say, "Can you give, it's great, Jim Bob Joe, but you know what? Mary Sue needs a chance." I'm going to kind of stop that and give Mary Sue. The goal is, though, is as the group goes along, I won't have to do that because the group will become cohesive and they'll do that. Okay. Assessing is assessing. Modeling is my behavior. Okay. So if a client, they're raising their hand, they're always on the phone, things like that, the way I address it would be how I'd hope the other clients, the other group members would address it. And suggesting. So that's at the last. We're not known for suggesting, are we? Okay. Initiating, evaluating, and of course, terminating. Okay. A good counselor. You should know the theories of group counseling, understand the principles of group dynamics. The healing happens in the dynamics. It's like this magical thing happens that you come every week with people you can't stand and suddenly you begin to like them and you can't wait to come to group and you feel free, and that's where the healing happens. Okay. Universality, of course, that's mutuality. Universality is okay in group therapy. Of course, it's not okay in individual therapy because we talk about the importance of cultural difference. But in individual therapy, group therapy, of course, it's mutual. Okay, intellectualization, you know that. Scapegoating. Scapegoating is a Virginia satire term. What does that mean? Anybody? Who's the scapegoat? Right. Good job. Oh, I see somebody typing. Someone's been brave. Anna, just speak.
Maybe the person that's the less to speak or one that's pretty guarded in the group, so the rest of the group may gang up on them.
Got it. You got it. It's the one that everybody gets together to pick on because and they're not picking on him. They're just blaming everything on him because it's easier for me to blame him than me to take ownership for my stuff, right? So that's a role. It's a family term as well as in something we'll see in group. Okay. With co-leaders, the one thing that you want to make sure that you have co-leaders is that you're using the same therapeutic approach. Co-leading is great, but you want to make sure you have the same approach that or even to that match, right? I can't be doing psychoanalytic theory and you're doing a behavior theorist, right? My behavior theorists don't even care how I feel, and then my over here my psychodynamic is asking me about my unconscious stuff. They just have to be on the same page. The term conjoint, that means usually a man and a woman in family therapy. Okay, so I usually want a man and a woman and a couple, or two people, two women in a lesbian couple. So that's conjoint therapy or cojoint therapy, where I have the leaders being two leaders and two people. Okay, group formation. Homo always means the same. Heterogeneous means different. Whether it's this or anytime you see it, that's what that prefix means. Okay, so homogeneity means that we're alike. Heterogeneous means that we're not. Now, that doesn't have to do with your sex or your color, any of those things. If we're all coming here for parenting, we can still be homogeneous, right? So if we're here for court-ordered parenting, and half of us don't want to be here and half of us hate it, that may not be a very homogeneous group. Okay, so they're composed of similar kinds of members. Okay, like heterogeneity, it's more in the real world. So if we have people that are different, that helps us prepare for the real world. Open and closed groups. My closed groups, they are done and you can't come in. Oh, sorry. Sorry about that. Okay, my closed group is we don't let new people in after it's over. Okay, so it is closed. So if as a professor, I've made my students go to like those AA meetings, of course. And the thing is that when they go, they have to call before to find if it's an open group or a closed group. Somebody tell me, why would I want to go to a closed group if I was really trying to get clean?
Well, for me, I think that in the closed groups, there are people there that may be serious or that may have been there for a while, whereas open is open to people that may have just recently stopped using or thinking about stop using, could still be in that pre-contemplation stage.
Look at you, and throwing in another word too. Yes, look at you, throwing in some trans-theoretical model. Look at you, I'm impressed. Who was that?
This is Ashley.
Oh, yes. So in general, she's absolutely right. Okay, so with AA, many times they're working the steps, right? So the AA philosophy says all you have to do is have a desire to be clean, to want to be clean. Okay, so then if I am I can still be using. I could show up and be drunk and high according to AA. And for people who are trying really hard to stick with those steps, having that person sit beside me is a trigger. That's hard. So a closed group really might be we're doing this many weeks, this time, and this is what's happening. So that's why the closed group for a lot of people works much, much better. Of course, the closed group, when people drop off, we don't replace them. So especially in the AA group, if we're doing the steps, we might be doing 20 weeks of group, and we'll start over at the step one again. However, right now, this is where we're at. Okay. Open group, people are always open to come. So which do you think is more cohesive, my open group or my closed group?
Closed group.
Of course, okay. In an open group, you can get all the way to like the last stage where you're like, working really well and everybody's performing and we're doing great. Have a new member come in, the group has to go all the way back down and start all over. Like, oh my gosh, that's difficult. So, okay. Average group is supposed to be, well, Medicaid pays 90 minutes. Oh, did I mention, by the way, one of the reasons I like group is because it's quite profitable. You can make lots of money in group. Okay, so again, if I'm doing 10 people at $75 a head, for 90 minutes, or I can do one person in an hour. So if I'm trying to hang up my own shingle and build a business, group is quite profitable, and that's not a bad thing. So there's nothing that says that we're not supposed to make money. Okay, so then screening. So the group association says you should screen. You should determine who can come in before group starts. So when it comes to like Corey as well as Yalom, they totally agree. However, in the real world, screening is not always an option, right? So when we talk about the theorists, we're going to see that Tuckman, who did my norming, forming, storming, he did not talk about pre-affiliation or pre-association. Okay. Again, informed consent, confidentiality, all those good things. Is there confidentiality? Is there a way I can make that happen in group? Don't ever speak a word outside of this group. Any possible? Not.
No.
So you've probably seen, I don't know if you've seen, but there's been a question that a man shares in group that he killed someone 7 years ago. And the question says, what is the first thing you do? So what do you do? So you've got a group, I'm assuming we're probably in like the forming stage, or I mean the norming or performing, because we've got to be really tight for him to share that. So we've got this group cohesiveness going on, and he shares with the group that he killed someone 7 years ago. What do you do? Anybody? What do you do? I call the police and turn him in. All I'm really going to do is my first thing is I want to check with my group to see how they're doing. When someone drops a bombshell like that, the first thing I want to do is say, wow, so what does the group think, or how's the group handling this? Okay, because my concern is remember, the group is the whole. That your group is your client, not just one. The whole group is your client. So I'm trying to check in to make sure everybody's okay. This is a big deal, right? Do I report that? Sure. I call him after and call the police and keep him? No, I can't report that. My code of ethics says I report if he's going to hurt himself or hurt someone else. That is a future tense, not a present tense, right? Or a past tense. Okay. Will I remind the group about confidentiality? Yes, I will. I will. However, is there anything I can do about that? If someone's, their thoughts or their common sense or whatever gets to them, there's nothing I can do. There's nothing I can do, but I will remind them. Okay. So let's see here. Group members, of course, can leave at any time. The norms of the group. Okay, so let's talk about our people. So Tuckman, my favorite, because he was so easy. And I remember him, and I figure if I remember him, then everybody else is just going to line up, right? Yes, Pam, because that's so much easier. So, stages of group. So when you're reading one of those questions, please remember to look at what it's asking you, okay? Because if it's stage 3 or not stage 3, but if it's an early group and they've just started, or if they've been meeting for 12 years, that changes things very much, okay? So what I'm going to look at, I want that one. Sorry, I want. Sorry about that, guys. I had one earlier that I really like. Okay, so whether you use Corey or Tuckman, the stages are going to be the same. It's just a matter of what words that we use. Okay, so then again, I like the forming, storming, norming because I can remember it. So first stage is going to be forming. That's my orientation, depending on which therapist you're using, which theory you're using. Okay, we get together, like everybody's nice, and they're not sure where to sit. They're so friendly, and kind. My storming, oh, we are fighting. You sat there last week. You brought the coffee last week. You're always late. I call it jockeying for positions. I want to sit next to them. I like that. All those things happen. At some point, it norms. And not because I norm the rule, just because the group norms the rule. My goal is to facilitate this normal process that's going to happen. That's it. Okay? They norm, they set the rules, they're working on stuff, they're performing, they're at their peak. People are sharing, people are calling each other on their stuff, all that good stuff, and then it's over. Okay, so those are Tuckman's rules. Again, but it's the same no matter who you use. Oh, no, but I logged out of my. Let me close the windows here, guys. I'm not going to pretend that kind of my desktop resembles the inside of my head. I know, but it's true. Okay, so then that was Tuckman. Yalom has his curative factors. Okay, so that's what he's known for. And you'll see tons of questions on his 11 curative factors of group. Okay, now these are Yalom's stages, which you'll see will line up very much the same as Corey's stages, right? Okay, so these are forming, storming, norming, working. Sometimes that's performing. That's adjourning. Okay, so Yalom did believe there was a pre-group or pre-orientation stage. Okay, but other than that, they pretty much lined up the same way. Okay, now his Yalom's therapeutic forces, these are his curative factors, right? Insulation of hope, universality, imparting of information, altruism. Altruism is doing the right thing without getting anything out of it. Like, I'm just going to do this, right? Okay. Development of social skills, imitative behavior, interpersonal learning, group cohesiveness, a sense of belonging. Catharsis, that is a Freudian term. It's like that emotional release, like, ah, or tears, or whatever. All of those things are part of that. And then, of course, my existential factors, those are things where I learned to take my own responsibility for things that I've done. So the goal of and the dynamics of group is that I can work through other issues in my life and then work through them to help me heal with other people around. There's somebody else big. His name is Joseph Moreno. What did he do, guys?
Psychodrama.
He did. That's it. That's it. So he was a group guy and he did psychodrama. What he believed is that we would kind of role play it, like work it out, right? So that's exactly what he did. Okay, so we're going to go over some questions related to our storming, forming, norming group questions. So give me 1 second, let me pull those up. I went through it quickly and I do apologize. I try to get lots of information in this 90 minutes. So it will be, it's in the box for you to watch it as often as you want. Slow it down, go back. And in general, learn the way you learn. Lots of my students really like those, like the colored cards and the things highlighted in red and blue and green. That makes my head hurt. Okay, but if that's you, perfect. So take this information, put it on your note cards, and go back and just go over it. For me, I would just listen to the video. I'm an auditory processor, but that's just me. And one of the things that you have to learn is how you learn best. Okay, so this is not an easy test. I'm not going to pretend. I'll tell you always break it down in pieces and bites. That's the way you eat an elephant, right? But you can do it. It's very, very doable. I'm pulling up some questions on my other screen here, guys. Give me 1 second. Okay, so can you see my screen? Yes, no, nod, smile. Yes, thank you very much. I just need to know that I'm not talking to myself as usual. Okay, so then look at number 313, which is not a curative factor of group according to Yalom. Okay, Yalom talked about curative factors. Which of these is not one of those? You can say something, really, it'll be okay. Okay, so universality, of course, is one, that you're not the only one having this issue. Insulation of hope, of course, right? It'll get better. It's got to get better. I've been there. I've gone through this. I've got this. Group cohesion, that's pretty important, right? Intrapersonal learning, unfortunately, is not the same as interpersonal learning. That's one of those prefixes that it's pretty important to remember because you'll see that a lot. So inter, I-N-T-E-R, I always think of intercourse. That means more than one person, right? I'm in it with somebody else. Intra means that I'm just me. So if we look back, so did he say inter or intra? Love it when you guys just chat with me. It's such a great group. So the answer of 313 is C. It's inter, I-N-T-E-R, because groups are about learning to get along with each other. So interpersonal. Okay. So look at 314. Jerry hears a fellow group member say, I'm really struggling with this divorce. I can't see a way to see the other side. It seems like I'll never feel better. Jerry experienced a relationship breakup himself, which spun him into a depression. Though the group members, the situation is unfortunate, Jerry feels a little better about hearing about it. Jerry is experiencing which curative factor of group therapy? What is Jerry experiencing? Is that impart? Sorry, my doggy's barking. So, imitative behavior, imparting information, insulation of hope, or universality. What is that? Right, universality. That is D. Okay, that is D. Okay, you can see my screen, right? Yes, gotcha. Thank you for chiming in. I'm gonna give you the thank you. Yes. Okay. So then, let's see here. I'm gonna skip down a couple there. Let's see. Okay. So 320. A group member is engaging in a side conversation in a psychoeducational group. The group leader stops and says, Mary, I'm sure that what you're talking about is very important to you, but you're missing out on some of the good content here, and it's difficult for me to teach because I'm distracted. Would you please put that on hold for now and resume it at the break? In terms of assertiveness skills, the group members will experience what curative factor? Curative factor, again, always means Yalom, right? Be brave. That is A. Okay. The group leader is role modeling effective communication skills. Okay. So that's part of it, is helping her learn this is what we do. This is how we should behave. Okay. So 321, Mary is also experiencing another curative factor. And that one is A, developing of social skills. She's learning how to behave in group, how to talk to people, how to develop those social skills. Okay. 323, an aspect of an open group is that group members can fit in and leave at any time during the group series as they see fit. Every group, anybody can leave, right? We don't put bars on the doors, so we want them to stay. But of course, this is client self-determination. Clients have that right. We're never going to make them stay. So of course they can leave. 324, a group member or leader terminating attendance at a group is a one-time event on their last day. So the same way that is not the way an individual, it is not that way in group. Okay, it is an ongoing event, and especially if you have an open group where people are going to leave and come at different times, you always want to acknowledge the fact of the people who are leaving. I did a drug group for many years where people who had just gotten out of prison, and the first thing, they had to report to me a few days after they'd gotten out of prison. They were so happy to see me, mind you. So then what they would do is they would have to come in, and as they were coming in, maybe somebody was leaving. So the people who were leaving, who had done what they were supposed to do, they got a certificate, of course, but they had to come to the front and just offer some advice to people who were coming through. Okay, that's all. Okay. 325, a closed group is preferred to an open group. Is what it is, right? That closed group gets smaller, people go away, and I can't add new people. Okay. 328, which of the following are appropriate rituals for termination? So then, all of those are fine, right? So it is D. So both A and B. I'm giving gifts. Not me giving gifts. My code of ethics says no. Okay, but the people in the group who've become very close to each other, they can give gifts to each other. We're good with that. Okay, so it's all of the above. So the answer is D, all of the above. I apologize. So gift giving, physical expression, positive regard, handshake, hug. That was pre-COVID, of course, sharing of food, pre-COVID, but all of those things after COVID will be just fine. So the group has become very, very tight. So when people leave, it's normal to mourn. It's normal to be sad. Okay. However, the goal is they'll go on, they'll do other things, but termination is not a one-time thing. You know when it's over. When you went to school, you had a day when you'd graduate. When you do supervision, you know when your hours are going to be up. All of those things you know ahead of time, not a last-minute decision. 330, we talked about this. The optimal size of group is 6 to 8. If I have children, it's 3 to 4. My little kids, if you've ever done a group with little kids who are like 6 or under, oh my gosh, 3 to 4 is a painful hour. Okay. So, but 6 to 8 is the optimal size. That's the best size for a group. 331. Every group should have a clearly defined group goal. Okay? Not true either. Not true either. Okay? So, especially sometimes my coping skills or support groups, I mean, we may have an agenda tonight. However, when there's pain, when something's going on, we're going to address that. Okay, so 323. So psychodynamic, what am I thinking? Freud, right? He's not the only psychodynamic, but he's what we're thinking. So leaders in a psychodynamic group are people who use that psychodynamic style of teaching. So I'm looking at D. Okay, so they are relatively passive and guide rather than lead. If you think back about Freudian, and many times he sat on the couch and the client talked, and he then interpreted what they said. Okay, so think about that. So relatively passive, letting the client share, and then I'm going to tell them kind of what my thoughts are. That's what. So if you're using the Freudian approach, that's how that works. Okay. 333. Which of the following are not valid types of treatment groups? That's a tricky one because they're all valid. It can be an activity group, it can be a self-help group, it can be supportive, psychoeducational. All of those are types of treatment groups. Okay, I'll remind you that though. So a counseling group is not the same as a therapeutic group or a therapeutic group or a psychotherapeutic group, not the same as a counseling group, especially for the test. Let's go down a few more. Oh, 337, we talked about Tuckman. He's my favorite because I can remember. So I'm going to form, then I'm going to storm. People are jockeying for positions. Norm, perform, and then it's over. Like, hey, we're good. Okay, so that's forming, storming, norming, performing, and adjourning. So if you remember those, you'll remember, and again, those are the easiest for me. If you grew up or if you went to college learning the Boston model, which is Yalom, or if you learned Corey's model, which is in school, either way, they're still the same. So whatever terms you choose to learn, they still go in the same order. Okay? And then when you're asking those questions, you're trying to figure out what's going on. The questions come up. We're trying to figure out what stage they are in group. So look at 339. Okay. You started a group a month ago. You notice this conversation that people have settled into a consistent seating arrangement and are having side conversations with with those next to them. Before and after group. Oh, they're getting tight, right? Three participants in particular have pulled you aside and told you that one of the other group members is annoyed and they're monopolizing the group time. This is a characteristic of what? Yeah. Okay. Got it. Okay. They're not storming. Are we sure they're storming? Is that a C? They're in that norming stage. Are they not? No, B. I'm sorry. They're in the storming stage. Correct. They're storming. You're absolutely right. They're storming. Okay. What do I do with this though? Bring it back to group. You don't get to come tell me. Bring it back to group because anything said in group stays in group. We're going to bring it back and we're going to talk about it in group. Okay. 340. At which stage does leadership become shared by group members? When does that happen? That one's D, at the norming stage. So as the counselor, I'm just holding on because in the beginning they're forming, and in the middle one they are storming. They're jockeying for positions. You did that. You did this. You did this. Oh my goodness. However, once they hit that norming stage, the group members norm each other, and it makes your job so much easier. And personally, I have found that that happens even in my court-appointed group. Okay. Let's see here. Look at 344. Psychodynamic again. So if you see those, what you're looking for is when I see psychodynamic, I'm thinking unconscious. Freud, id, ego, superego, oral, anal, oral, orphan, Annie, pretty little girl, oral, anal, phallic, latency, genital. Anything about Freud, I'm thinking, oh! So remember, I'm going to use that approach. And the answers will lie in the question, right? So I'm going to go back to the question and tell me, what do I see? So you're a leader in a psychodynamic group. The group formed about 5 weeks ago. Tonight, one of the group members made a disrespectful comment to the other. What should you do? And you're a Freudian approach, psychodynamic. What would you do? Remember, we learned in those earlier questions that my Freudian people are not very active in group, right? The answer to that one is C. As the leader, I'd speak up, I reiterate the group rules, and redirect the client who made the disrespectful comment. I would do that because what stage of group are they in? They met 5 weeks ago. They're obviously still in that storming. They're storming if somebody's going to be mean to anybody, right?
Yeah.
Okay, they're not there yet. Because if it were a norming, good job, by the way. Thank you for being brave. Yes. Okay. If they were in the norming stage, I wouldn't have to say anything. The group would handle it. Okay. And they probably wouldn't make a disrespectful comment because that's when they're working. So they're still at the storming stage. So that's why the group leader has to say something. Okay. So it wouldn't matter if you're a psychodynamic or a gestalt or whatever, I would still say something because of the stages of group that they're in. And so you see 5 weeks. So what you have to remember is, I mean, I don't know if they're meeting every week or every day. So my key is reading the clues to tell me what stage that they're in, right? So they could be in the performing stage, right? Because if they're tight, they meet every day. But the only way I know is by reading the question. Okay, and I can't tell you enough. To pass this test, go back to the question. Prove it to me in the question how you know the answer. And don't guess. Don't guess. You know how to make how to rule out what it can't be. You will never know everything on this test. I could tutor you, teach you 7 days a week for the next, 6 months, and there's going to be something that you haven't seen before. So remember to know what you do know. Rule out what it can't be. Always, there's most often 2 that you can rule out, and then the 2 that I have left, I'm going back to the question. Based on my knowledge, based on what the question asks, I'm going to prove it to you in the question. Okay? 345. So from the scenario above, which of the following would be your best response? Okay, 345. We're looking at that one. 344 was C, by the way, if you didn't get that one. $345. Which of the following would be your best response to the scenario above? The assumption, of course, is you're the leader, right? So 345 is going to be C. John, it seems you have a very strong opinion about Mary's behavior, and you have a right to your opinion, but the way you said it sounded disrespectful. Can you please rephrase it? Okay. Remember, I'm in the early stages of group. Okay, so I'm still modeling. I'm teaching them how to do. I am facilitating. I'm working a whole lot harder now than I plan to work down the road. So I've got to say something in this early stages of group. Okay. 347. Several people are talking at once, and Jamie speaks up and she says, "Why don't we each take turns so we can listen to each other? I am sure we'll have good things to say." What group role is that one? Jamie's the gatekeeper. She's making sure that everybody follows the rules. Okay. Sometimes the gatekeeper or the key holder is the term you'll hear at an AA meeting. So, those mutual self-help, AA, NA, they don't have a formal leader. The person who runs the group is most often the person who's been the cleanest the longest. And that follows the AA traditions that when you're clean, you're supposed to bring someone else over with you. So that person sometimes is the gatekeeper, the key holder. And there are many times just to make sure the chairs are put up, to make sure that people don't crosstalk. All of the rules of AA. Because remember, those are mutual self-help. There are no professionals that run those groups. Okay. So 348. Bob shares that depression is the leading cause of disability in the United States after another group member shares her struggle with it. Bob is playing what role? He's an information giver. He's sharing information. It's not his opinion because the depression is the leading cause of disability in the United States. Now, that may not be true, but I can't question that, right? All I do is stay within those lines. So my assumption is if Bob said that, that must be correct information. So remember, stay within the lines. Do not bring any information. Well, how does Bob know? Maybe that's just Bob's opinion. Nope. Sorry, doesn't work that way. All you have to do is, all you know was in those 2 lines, and the assumption is that my clients were telling the truth. And I know with substance abuse, it's hard to believe, but okay, let's see here. I'll look at this one. Okay, so in 363, which method of conveying pre-group information was not, no, I'm gonna skip that one, sorry, you wouldn't know that one. And you don't need to know that one. So I wasn't trying to, that's something you just probably is not one of the most important things. 364, which of the following demonstrates attending to group process? Attending just means I'm in the moment, I'm paying attention, I'm quite aware of what's happening in the process. So 364, what is that? That one is C. Okay, so A, Sarah, you're shaking your leg. That's definitely, I've noticed that. B, Jessica, you said you had a solution. Can you share it? Again, that's part of being aware. But C is I'm really attending. I am watching the body reaction, the body movements of my clients or of the group members. Jessica, you started picking your fingers when Samuel started talking. So just like with individual therapy, I'm trying to read. I want there to be congruence, right? I want their mouth and the body and all those things to line up. And if they're not lining up, then I'm concerned with that. Okay, I'm going to wrap you up, guys. I'm going to stop recording. I'll open it up for just some questions in just a moment. Let me just stop recording.